as we look to the future, we cannot have a long-term economic recovery plan or balance the federal budget without addressing our healthcare system. A lot of people say, why are we talking about healthcare now? We got these record deficits. We've got a war, 2 wars going on. We've got recession. This is the very reason why we got to address healthcare now. 40 cents out of every tax dollar today goes to Social Security, Medicare, and Medicaid. If we don't change healthcare, if we don't contain healthcare costs and stop the growth of healthcare costs in this country, it will take every dollar of federal revenue, 100% of all federal revenue by 2040 will go simply to cover Social Security, Medicare, and Medicaid. We will no longer have a Department of Defense, Department of Education, or Department of Agriculture. Obviously, we cannot afford to let that happen. No one's talking about, rephrase this, no one in Washington is talking about socialized medicine, single-payer health care, national health care. No one's talking about that. You'll have to listen to talk radio to hear that. No one in Washington is talking about it. I'll tell you what we are talking about. We're talking about containing the cost. You'll always have the options to choose what procedure you want and all that. We're not talking about any of that. We're talking about in the banking business, administrative overhead is 1 to 3%. In healthcare today, it's 40%. Up to 40% of the cost of healthcare today is pushing paper. We're talking about medical errors, which we can reduce through, the doctors here will tell you, we can reduce substantially through medical information technology. We're talking about chronic disease management. If we just properly educate and manage diabetics, we can save trillions of dollars a year. These are the kind of things we're talking about when we talk about containing costs. Access is the other one. I used to own a small business. I know how hard it is to provide employees health insurance. What we're talking about is small businesses, which are the backbone of this country. Small businesses, the self-employed, the uninsured, they should have group plans available through the private sector where private companies compete for their business. Right now, they don't have, I don't know how many of you here own a small business, but most of you that do probably don't even have access to a group plan, and if you do, you can barely afford it. I know when I was in business, we had to do individual plans for everybody. We've got to be able to make health insurance affordable, available to the small businesses, the self-employed, and the uninsured. And finally, we're talking about rural health care. The reason we're doing it primarily is this. We cannot balance this budget without getting, everybody's worried about national health care. I'm telling you, it's not on anybody's radar screen. We're not doing that. But the fact is, half the people in America already have it. It's called Medicare and Medicaid. And we cannot get this number to zero without controlling and containing health care costs in this country. 1 out of every 4 working Arkansans, and I emphasize working, 1 out of every 4 working Arkansans are uninsured. Tragically, more than 1 working-age Arkansan will die today for one reason: he didn't have health insurance. Now, that sounds like a statistic from a third-world country, but it's a statistic from Arkansas in the heart of America. Sadly, the crushing cost of health care now causes bankruptcy in America every 30 seconds. Small businesses are the backbone of our local economies, and costly health care should not be a determining factor in whether they survive or fail. In the last 8 years, health insurance premiums have grown 4 times faster than wages, which forces many employers to reduce or forego employee pay raises just to cover the increased health care costs for their employees. That's where your pay raise is going. And if you think you got health insurance today, don't think for a minute that you may have it tomorrow. A lot of folks see how much is held out of their check and they think, wow, this is what health care costs? No. On average, nationally, employers are subsidizing the cost of employee health care to the tune of 84%. And that number is going to continue to drop, and the employee's share is going to continue to go up, so we finally reach a point where neither the employee or the employer can afford to provide it. But if you're one of those that have health insurance and you think none of this affects you, it does. Because those of us blessed enough to have health insurance, the first $1,000 we pay this year for health insurance premiums has nothing to do with our care, our family's care, or anybody in our group's care. It's got to do with paying for the uninsured. I'm chairing the Conservative Democrats Health Care Task Force. I'm a member of the House Health Subcommittee, and in that role I was invited to to one of about 25 members of Congress invited to the White House Health Care Summit back in March. And what struck me was several things. One, everybody that was against health care, Teddy Roosevelt tried health care reform, Richard Nixon tried it, Jimmy Carter tried it, Bill Clinton tried it. Everybody that was against it last time had a seat at the table. Patient groups, consumer groups, insurance groups, provider groups, everybody that's a player in this, including the patients, had a seat at the table. And unlike last time, this time everybody agrees that we got to do something. Now the big question is, can we agree what that something is? The president said this at the healthcare summit. He said, here's where we're going to start this healthcare reform debate. If you got health insurance today and you like it, you'll always be able to keep it. And you'll always be able to choose your own doctor. I think that's a good starting place as we begin what's certainly going to be a lot of hearings and a lot of work in the coming months. What I told the president at that healthcare summit was that rural health care has got to be a priority in any major health care reform package. Rural health care. And I know this, unfortunately, better than y'all do. Y'all still got a hospital here. We lost the hospital in my hometown in 1995, and I don't wish that on anybody. I was thinking back 20 years ago, we had a hospital, now we don't. We had 6 doctors, now we got 3, 2 of which are over the age of 65. We had 5 pharmacies, now we got 2. We had 4 home health agencies, now we got 1. That's not just Prescott, Arkansas. That's rural America. And you can find that all across rural America. You're having struggles here. I see a doctor nodding his head. And I'll tell you, I'll never forget Hot Springs. Folks in Hot Springs at the hospital called, said it was urgent, they needed to meet with me. I rushed up to Hot Springs to meet with them. You know what they wanted to talk about? They can't get doctors to move to Hot Springs. Now, we got Democrats, Republicans, and Libertarians, and Greens, and people that, there are people from all walks of life in here that all think differently. But I think there's one thing maybe we can agree on, I hope. And that is, if we had to make a list of the top 5 towns in Arkansas to live in, obviously Warren and Prescott would be at the top of the list. But I think most of you would also put Hot Springs in that list. And if they can't get doctors moved to Hot Springs, what does that say about the future of Warren and Monticello, Fordyce, and surrounding communities? Too many of our rural communities are losing doctors and hospitals at alarming rates. Many people live miles from a healthcare provider and struggle to get the regular medical attention they need. We cannot address healthcare reform in this country without addressing the healthcare needs of our rural communities. Finally, this. For too long, corporate greed has dominated Wall Street and unfortunately threatened our national economy. As our economy slipped into recession in 2007 and on in 2008, now in 2009, the longest recession since the Great Depression, many of our nation's major banks and companies began to fail. If you'll go back with me, it's 6 weeks before the election. The polls are dead even between McCain and Obama. And then President Bush goes to the American people, he comes to Congress, and he says, if we do not rescue the banks immediately, we're headed for a depression. I think when he did that, he cost McCain the election. And I think he knew he was probably costing McCain the election before he stepped out there and did that. But his economic advisors did not believe they could wait 6 weeks. Believe me, if they could have, they would have waited. We were in a lot of briefings, a lot of meetings. We read a lot of information. And I can tell you that some of the most respected economists and financial folks in this country, not Democrat or Republican, but just folks that know the stuff, believe the debate wasn't whether we were going to have a depression. The debate was whether it would be days or weeks because of this electronic era that the banks operate in today. It took months. It took months in the Great Depression of the 20s and 30s, obviously. Today, the big debate was could it happen in days or weeks. Basically, our choices for this. We do nothing, have a depression, then I'm here, and you're asking me why we need to do anything. The other choice was this. Rescue the banks, stabilize the financial markets, free up credit to where it doesn't totally drive, but they made it clear. They were very fair. They made it clear, telling us that even though we would avoid all that, we would still have a worse economic recession in our lifetime.